2-minute to 10-minute bleed is what is considered to be normal. So, the supplies you need are going to be your filter paper, your Surgicutt lancet. You're going to need a Band-Aid, as well as a butterfly closure Band-Aid. You're going to need your alcohol and your 2x2 gauze. So what we're going to do is we're going to go ahead, put our blood pressure cuff on our patient. Can you please tell me your name?
Michelle.
So, again, this lab is not like a venipuncture where you're actually going into a vein. This actual lab is done right here in the forearm. So what we're going to do is we're going to go ahead. We still want to alcohol off our site. And again, we're going to let that dry.
She looks all
Alrighty. Now that that's dry, what we're going to do is go ahead and increase our blood pressure cup up to 40 millimeters of mercury. And it needs to stay there for the entire duration of the test. So you're going to have to go back and forth, maybe looking at it, making sure that it stays at 40. We want constant pressure so that the results aren't skewed. Now, this is our Surgicutt lancet. We're actually going to take it, press it on the skin. We make our slice.
Oh, that was easy. I thought it was going to be a bigger
No,
cut.
it's not a big cut.
I was like, that's probably like this.
Now, I went ahead, I sliced her skin, so what I'm going to be doing is every 30 seconds, I'm going to record information. So I have to wait 30 seconds before I can actually get my first sample. It's best to wick off of the 12 and the 6 or the 3 and the 9 on the clock because they're across from each other. What you do is go right up to the edge. We'll get our first sample. We're going to turn our wick. And again, this is done at every 30-second increment. You have to make sure that you're paying attention because if you do it on the 15-second increment, then you're going to throw off the test. I like to keep my spaces relatively close together, but not so close together where the blood is actually starting to run into each other. You can also use a stopwatch. If you have a stopwatch, you can also use, some people use a timer when they actually do it. Some people set their cell phone for every 30 seconds. You don't want to go directly on top because if you do that, then the platelet function is actually starting. You're going to pull that platelet function away.
It's because you're thinking about them pancakes?
Yes. Sometimes you have to go to a second paper. Just clean off this site just a little bit. And again, I don't want to touch where the actual cut itself is. I'm going to use a butterfly closure Band-Aid. So I want to pinch the skin before I put the butterfly closure on. I want to tell my patient to make sure that she doesn't get this wet and that she doesn't remove the Band-Aid for at least 24 hours or she may risk scarring if she does that. Dots together because then that actually helps me count accurately how big that bleed is, or better yet, how long the bleed is. 22. Now I have a dot here, so this would be 22.5, but I have to count when no blood comes through the paper, so this is 23. So she actually has a 23-minute bleed. ID number?
2933.
2933. Today is 3/3/15. The time is now 9:55 a.m. She had a 23-minute bleed. We have to let the doctors know that normal is 2 to 10. No anticoagulants, so we're going to put that on the actual wick. No anticoagulants. So that they know. So, this is how the label would go.